7 hidden diabetes signs between 5 a.m. and 7 a.m. It starts while the world is still asleep, between 5 and 7 in the morning. The sky is dark, the house is silent, and you wake up. But something feels off. Your mood is heavy, your head foggy. Maybe your heart is restless for no reason. You think it's just another morning, but beneath the surface, your body is sending quiet warnings, signs that your blood sugar may be out of control, long before a diagnosis ever shows up. Most people ignore these moments. They reach for coffee, blame age or stress, and move on with their day. But what if those small discomforts are the first clues of something deeper? What if the early morning holds the key to spotting diabetes while it's still silent? These are the hidden signs that show up when no one's watching. Not during meals, not in the middle of the day, but in the quiet hours when your body speaks the loudest. Here are 7 warning signs of diabetes that often appear between 5 a.m. and 7 a.m. And number 1 might already be happening to you. Number 7, irritability or mood swings right after waking up. You open your eyes, and before you even speak to anyone, you feel it. A weight behind your forehead, a strange tension in your chest. Maybe you're snapping at your partner, or you feel like crying for no reason. You chalk it up to stress, aging, or a restless night. But what if the truth is darker? In the quiet hours before the sun fully rises, your blood sugar could already be shifting wildly. And those shifts don't just affect your body, they hijack your brain. Low blood sugar can starve your brain of the fuel it needs, making your emotional state unstable, even volatile. On the flip side, high blood sugar can create inflammation that disturbs normal brain chemistry. Either way, what you feel emotionally may be coming from deeper inside than you think. This kind of irritability isn't ordinary. It comes out of nowhere. It doesn't match your surroundings or your thoughts. It just arrives uninvited. One minute you feel fine, the next you feel anxious, overwhelmed, or irrationally angry. These mood swings in the early morning can be one of the body's earliest signs that something is wrong with glucose regulation. Your brain is an energy-hungry organ, and when blood sugar levels rise or fall too quickly during the pre-dawn hours, that delicate balance is disrupted. It's like your internal wiring short circuits, and what you experience is not just an emotional reaction, but a physiological cry for help. Most people never connect the dots between their emotions and their metabolic health, and that silence keeps the damage going. When these early mood disturbances happen frequently, especially upon waking, they should never be ignored. Over time, blood sugar instability can do more than just affect your mood. It can contribute to long-term cognitive decline, depression, and other serious mental health disorders. What's worse, many of these symptoms are dismissed or misunderstood, allowing the underlying blood sugar problem to grow unchecked. If you've noticed that your mornings begin in chaos, emotionally or mentally, it's time to pay attention. It's not just who you are, it's what your body is going through. And this may be your first clue that something beneath the surface, something hidden, is beginning to break down. Number 6, tingling or numbness in hands or feet. You wake up and something feels strange. Your fingers tingle. Your feet feel like they don't belong to you. Maybe it's a light numbness. Maybe it's more like pins and needles, that electric, crawling sensation that fades as the minutes pass. But while you shake it off and move on with your day, something deeper may be happening beneath the skin. These sensations are often dismissed as poor circulation or just sleeping on your arm wrong. But when they happen often, especially early in the morning, they could be one of the first signs of diabetic nerve damage. Long before you hear the word neuropathy from a doctor, your body might already be whispering it to you through numbness and tingling. This isn't just about temporary discomfort. It's about a pattern, one that, when noticed, can be a powerful clue. During sleep, especially in the early morning hours, blood sugar levels can fluctuate dramatically. For someone with prediabetes or undiagnosed type 2 diabetes, these fluctuations can damage the small nerves in the extremities. These nerves are delicate and sensitive, and the feet and hands are often the first places where damage shows up. That's because they're the farthest from your heart, and small blood vessels struggle the most when blood sugar runs too high or drops too low for too long. The tingling you feel is like a warning siren, low and subtle, but deadly serious. And the danger doesn't end with morning discomfort. Left unaddressed, this early nerve dysfunction can evolve into full-blown peripheral neuropathy, where pain, burning, and complete numbness take over your quality of life. People with undiagnosed blood sugar problems often don't realize they're already losing nerve function until it's too late. What starts as a strange feeling in the morning can become a lifelong complication. That's why paying attention now, when the signs are soft and strange, could save you years of suffering later. Don't brush off the tingling. It's not just a quirk of age or position. It could be the sound of damage already beginning. Number 5, morning headaches. The alarm goes off, and before your eyes even fully open, the pain is already there. A dull throb behind your temples. A squeezing pressure around your skull. Sometimes it feels like your head is stuffed with cotton. Other times, it's sharp and pulsing. You haven't eaten anything yet. You haven't even moved. But your body has, all through the night. And while you slept, your blood sugar may have dropped too low, only to spike back up suddenly in a desperate attempt to stabilize itself. This phenomenon, known as the Samajaya effect, is silent and unseen, but its aftermath is felt clearly the moment you wake. These morning headaches don't just appear out of nowhere. They often result from the brain's extreme sensitivity to blood sugar fluctuations during the night. Glucose is its primary fuel, and without a stable supply, your brain struggles to function properly. When sugar levels dip too low, the body releases stress hormones like cortisol and adrenaline to raise it. But this overcorrection can lead to sudden spikes that trigger inflammation and vascular changes in the brain. The result? You wake up not refreshed, but in pain. And what's more disturbing, you probably don't even know it's related to your blood sugar. If these headaches happen frequently in the early morning hours, it's time to stop treating them like isolated incidents. They could be part of a larger pattern, one where your body is stuck in a nightly battle to balance your glucose without the proper support. Over time, these cycles wear down not just your energy, but your brain health. Chronic blood sugar swings have been linked to cognitive issues, memory decline, and even increased risk of stroke. A morning headache isn't just an inconvenience. It may be the first signal that your brain is under metabolic attack. And ignoring it might mean missing your chance to intervene while there's still time. Number 4, blurry vision when you first open your eyes. You wake up, blink a few times, and everything looks wrong. The room is there, but it's hazy. The outlines of furniture blur together. The numbers on the clock are fuzzy, like you're looking through fog glass. Maybe it clears up after a few minutes. Maybe it takes longer. You tell yourself it's just morning grogginess, that your eyes need time to adjust. But the truth could be far more serious. What you're seeing might not be about your vision at all. It might be your blood sugar, shifting overnight, disturbing the fluid in your eyes, and leaving your vision temporarily impaired. This type of blurry vision isn't just about needing new glasses. It's caused by rapid changes in glucose levels that affect the shape and hydration of the lens inside your eye. When blood sugar rises too quickly or crashes too hard, it draws fluid into or out of the lens, changing how light is focused on the retina. The result is a distorted, inconsistent image. And though it may seem like a harmless nuisance, this early warning sign is easy to overlook and dangerous to ignore. Because if your eyes are reacting this way in the morning, chances are your entire body is under the same metabolic pressure. Over time, this silent stress on the eyes can lead to far worse outcomes. Diabetes is one of the leading causes of blindness, not because it strikes suddenly, but because it begins subtly. A little blur, a little fog, a delay in focus that grows longer with each passing week. By the time most people take action, the damage is already underway. That's why paying attention to your first moments of vision each morning matters more than you think. If you wake up often with blurred sight, don't assume it's just tired eyes. It may be your body's early attempt to show you that your sugar is out of balance, and that your eyes are the first to see the danger. Number 3, dry mouth or excessive thirst upon waking. You open your eyes, and immediately, your mouth feels parched. Your tongue sticks to the roof of your mouth, your lips are cracked, And no matter how much water you drank the night before, it feels like you haven't had a drop in days. This isn't just morning dryness. It's a persistent, unrelenting thirst that greets you each dawn. While it's easy to dismiss this as dehydration or a side effect of sleeping with your mouth open, it could be a more insidious sign. High blood sugar levels, especially during the night, can lead to a condition known as xerostomia or dry mouth. This occurs when elevated glucose levels cause your body to draw moisture from tissues, leaving you dehydrated by morning. This excessive thirst, medically termed polydipsia, is a hallmark symptom of diabetes. As your blood sugar rises, your kidneys work overtime to filter and absorb the excess glucose. When they can't keep up, the surplus sugar is excreted into your urine, dragging along fluids from your body's tissues. This process not only dehydrates you, but also triggers an unquenchable thirst, prompting you to drink more. It's a vicious cycle. The more you drink, the more you urinate, and the more dehydrated you become. This relentless loop can be one of the earliest indicators of diabetes, often manifesting subtly in the early morning hours. Ignoring this symptom can lead to more severe complications. Chronic dry mouth can result in difficulties swallowing, speaking, and tasting. It can also increase the risk of dental issues like cavities and gum disease, as saliva plays a crucial role in neutralizing acids and washing away food particles. Moreover, persistent dehydration can strain your kidneys and other organs. If you consistently wake up with a dry mouth or an insatiable thirst, it's essential to consult a healthcare professional. Early detection and management of blood sugar levels can prevent these symptoms from escalating into more severe health issues. Number 2, extreme fatigue despite a full night's sleep. You went to bed at a decent hour, slept 7, maybe 8 hours. No alarms, no interruptions. And yet, when morning comes, it feels like you barely slept at all. Your body is heavy, your thoughts are slow, and the idea of facing the day feels like a burden. This isn't normal tiredness. It's something deeper, something that sleep alone can't fix. What if the reason you're so exhausted is because your blood sugar has been waging war with your body all night long? Even in rest, the systems that regulate glucose continue working. And when they fail to do so properly, the cost is your energy, your clarity, your vitality. When blood sugar levels are unbalanced overnight, the quality of your sleep deteriorates, even if you never wake up. You might never notice it happening, but inside, your body is constantly reacting to sugar highs and lows. High glucose can interfere with deep sleep, preventing the brain from entering the restorative stages it needs to repair and recharge. Low glucose can trigger stress responses, causing your body to release hormones like adrenaline and cortisol, making your rest shallow and fragmented. You wake up not refreshed, but drained, and worst of all, unaware of the internal chaos that caused it. This kind of persistent fatigue is one of the most insidious early symptoms of diabetes because it's so easy to rationalize. You're aging. You're busy. Maybe you're just stressed. But none of those explanations address the biochemical truth that your cells may be starved for energy even as your blood is flooded with sugar. Without proper insulin response, glucose can't enter your cells to fuel them, leaving you tired at the most basic level. So if you're waking up every day feeling like you barely slept despite doing everything right, don't ignore it. Your exhaustion might not be about what you're doing. It might be about what your blood is failing to do. Number 1, high blood sugar first thing in the morning, dawn phenomenon. You haven't eaten a thing. No breakfast. No midnight snack. And yet, when you check your blood sugar first thing in the morning, the numbers are unexpectedly high. It doesn't make sense until you learn about the phenomenon that haunts the early hours, the dawn phenomenon. Between 5 and 7 a.m., your body naturally releases a wave of hormones, cortisol, adrenaline, growth hormone, all designed to prepare you for the day ahead. But in someone with insulin resistance or undiagnosed diabetes, these hormones trigger a spike in blood sugar that the body can no longer control. You wake up already behind, already in a metabolic storm that started before you even open your eyes. This early morning surge isn't just a curious pattern. It's one of the first red flags that your insulin function is faltering. In healthy individuals, insulin rises in tandem with those hormones to keep blood sugar stable. But when your cells stop responding properly, the glucose rises unchecked. And this daily spike can silently contribute to long-term damage to your nerves, your eyes, your kidneys. What's most dangerous is that it feels invisible. You feel no symptoms at first, no warning signs, just a slow, steady progression until suddenly you cross the line from pre-diabetes into something far more permanent. For many, this is the first measurable clue that something is wrong. It's not tied to food or activity, which makes it easy to overlook. But if you're testing your glucose and noticing consistent morning highs, even on an empty stomach, you're witnessing your body's internal imbalance firsthand. This is your warning, your moment of choice. The dawn phenomenon isn't just a number on a screen. It's the body's final nudge before consequences become complications. And if you listen now, if you act now, you still have the power to turn it around before this quiet morning spike becomes a daily descent into disease. Your body doesn't wait for a diagnosis to show signs. It whispers them quietly, persistently, in the hours before the world wakes up. Between 5 and 7 a.m., while everything outside is still, the battle inside begins. Irritability, thirst, numbness, fatigue, these aren't coincidences. They're warnings. And the longer you dismiss them as just aging or just stress, the closer you move toward a life ruled by disease instead of choice. But you're not powerless. If any of these signs felt uncomfortably familiar, don't brush them off. Speak to a health professional. A simple blood test could reveal what your body has been trying to tell you all along. The earlier you know, the more you can prevent, before damage becomes diagnosis, and before warning becomes crisis. Your mornings are telling you something. The question is, are you ready to listen?